Awesome. Hey, tech is going well on a Monday. That bodes well. All right, am I unmuted?
Yes, ma'am.
All right. And away we go. Good morning. Welcome to the last week of class. This is it, the final 2 classes. It went fast, didn't it? Yeah, it does. It goes fast. Does anybody have any questions for me? Anybody have any questions? All right. Good morning. Let me go ahead and get your scores for chapters 8 and 9. Does anyone have any questions on what you missed? This is going to be on page 188 and 189 of your skills book, the spiral book. Okay, Brianna. Natalie. Natalie, do you have 7 for me? Thank you. Katie?
I got 95 on 8 and then on 9, 100.
Thank you. Can I get 2 through 7 from you as well?
2, I got 100. 3, I got 100. 4, I got 95. 5, 95. 6, 95, and then 700.
Thank you very much. Cody?
200.
Thank you. Thanya?
8 is 95 and 9 is 80.
Thank you. Elena? Haley? August? Justin? Holly?
200.
Thank you. William? Brandy?
200.
Brandy, do you have, let's see here, 5, 6, and 7?
100 for 5, 6, and 7.
Thank you. Special? Harmony.
I'm doing them right now.
Okay. And
I think I was missing.
I actually need all of your scores. Yeah.
Okay, from 1.
Yep.
Okay, 90, 90, 80, 100, 90, 75, 100.
Okay. Very good. Very good. All right. Does anybody have any questions on any of the reading, on what you've missed, on any of the instruction that we've had? Any questions? Today, we are going to finish up skills. So we have 3 skills to learn. They're all toileting skills. There's bedpan, catheter care, and emptying the drainage bag. It's not going to take long to teach you those. So you will have about an hour, maybe even an hour and a half of practice time today built in to the end of the class. So you will have quite a bit of practice time, providing I don't get too off topic. Practice is important. I had a woman call me on Saturday from Hawaii, and she's testing today. And unfortunately, she graduated her class in Hawaii back around Thanksgiving, and she put off studying until the weekend before class. So Saturday morning, her time, she calls me and wants to know, I don't remember, how do I prepare for the test? And there wasn't much I could tell her to do. I mean, with just 2 days, you can't learn an entire CNA program in 2 days. So the biggest advice that I gave her were the worksheets. Go print off those review worksheets. Those will help you master the principles that you need to know, but you need to be practicing these skills. And that's the only way to develop muscle memory. I want you to think back to when you started driving. Okay, so you're around probably 15, 16 years old. You watched the people that were driving. Okay, so you saw what they did. You kind of paid attention to when they hit the blinker and how quickly they hit the brake pedal before they stopped, all those things. You start paying attention to those things. Before that, it really didn't matter to you. You were just passenger princess, right? But after that, you started paying attention before you got your learner's permit. And then you go take your test to get your permit. Well, that permit is all about giving you the ability to practice, right? How many of you guys would go take the driver's test without ever once having sat behind the wheel? Would that even cross your mind? What would happen if you took the driving test without ever having driven? Yeah, you're going to fail, right? Well, the CNA exam is the exact same thing. It is a skills-based exam. So if you wouldn't go take the driving test without driving, then you certainly shouldn't be playing with human lives without understanding what you're doing, without having some practice. Does that make sense? Practice is important. But the one piece of advice I gave her over the phone is the advice I'm going to share with you. The test isn't about, I want to be a CNA. That is not what this test is about. This test is you telling the state, I am ready to be a CNA. That's what this test is about. The learning doesn't happen on the other side of the test. When you take this test, you are saying, I'm good. I'm ready. If I have to do a partial bed bath, I can do that. If I've got to do mouth care, I can do that. If I've got to do range of motion, I can do that. Let me show you. That is what this test is about. So if you are not ready to work, you are not ready to test. And that's the piece of advice I gave her. The test isn't the end. Everybody looks at the test as the end. You take the class, you take the test. It's the end. It's not. That test is your entrance into healthcare. If you're not ready to enter healthcare, you're not ready to test. Does that make sense? I want to be very, very clear on that. Because if you're not practicing, you're not ready. Good, good. I want you guys to succeed. The test is expensive, and you have to pay for every attempt. I want you to pass the first time, but there's only so much I can do with that. The rest is up to you. But you guys are all going to be fine as long as you practice. Good? Yeah. All right. One class left. That's it. One class. And today we're finishing up skills. So that last class is going to be all about employability. I'm going to talk to you about how to find a job in healthcare. It's different than other industries. If you approach getting hired in healthcare like you do any other industry, you're not going to be successful. It is different. And nobody really talks about that. We should talk about it. We're going to talk about how to make a good impression during an interview, including how to answer that question, tell me a little bit about yourself. That's a question everybody stumbles on. You know it's coming, and it's an open book test. It's on you. And yet everybody just looks with a deer in the headlight. I don't know. What do you want to know? What you want to tell them is why they should hire you versus all the other people that have sat in that chair this week. And I'm going to give you a really easy way of doing that that's specific to you, but will convince them that you are the best person for the job. So the students that have been using this are getting hired. So I'm going to give you that formula. We're also going to talk about renewal and continuing education. What's required? How do I get it? We're going to talk about what we need to report to the Board of Nursing once we are certified. So there's a lot of content that we're going to be covering on Wednesday, graduation day. You will need to bring your yellow book back to me on Wednesday. Okay, yellow books come back to me. So if you got behind on your reading, you've only got one day to get caught up because you're bringing that yellow book back to me. Good? Make sense? Everybody okay with that? All right. Remember that these testing care plan sets are available. You can purchase them. They have the actual checklists on the back, including indirect care. You've got the front of the checklist on page 25 of your book, kind of tell you a little bit about what you're going to be required to do. Game show will be next Tuesday, a week from tomorrow. So after graduation, you might want to mark your calendars. This is going to be very, very relevant to you because this will probably be the one right before you go test. So tune in for the game show. And then if you have not contemplated CPR, there's a lot of, how do I put this? A lot of people don't understand misunderstandings between CPR and BLS. What is the difference? So CPR is for lay people, people that are not employed in medicine. So I used to teach 9-year-olds to do CPR. I worked for the school board, and I used to go into 4th and 5th grade classes and teach 9-year-olds how to do CPR. I can teach anybody to do CPR. It's chest compressions, call 911. That's CPR, okay? If they've been down a while, blow into their mouth too. If they haven't been down a while, just chest compressions are fine. I can teach anybody to do CPR. BLS is CPR. Same things, exact same things. But because it's for medical professionals, we've got some additional toys that we can bring to the party. We've got masks, we've got AEDs, we've got some other processes we have to talk about because we are medical professionals and have more toys. So BLS is CPR. The two are the same. It's just that BLS is going to teach us what to do with all those extra toys that we have to play with. Okay. So if somebody tells you in a job description that BLS is required, that's what they're talking about. It is CPR, but it's CPR for healthcare professionals. You want a BLS class because you're going to be healthcare professionals, right? So Julie offers this class. You don't need the CPR for the class. You don't need it for the test. You will need it to work. So make sure that you mark your calendars. Take a picture of the QR code. It's on the blue paper you got on first day. So you should all be starting to think right now, where should I be working once I get this class done? Where's a good place for me to start? And this is a question I get all the time. Where do I start? And the answer is, well, it really depends on you because your personality is going to play into this. I am a high energy person. I am a problem solver. If I have to do the exact same thing every single day, I go out of my mind. I am bored. If I don't have a problem to solve, I'll create one. Okay. So routine, mundane, do the same thing every day types of jobs are not good for me. That's not in my wheelhouse. I am much better in the ICU, in the ER, working with hospice patients where their condition is changing rapidly. That's where I'm going to thrive because there's problems to solve. Make sense? Now, if you're the type of person that doesn't like problems, you want to go in and do the exact same job every single day and no variation, that's great. There are settings for you. Some of you are people. You like gathering in groups. You like talking. You like team environments. You like working together. You like that social aspect. Home care, not going to be it for you. You will feel socially isolated. You will feel alone and you will wash out. If you, however, are the type of person that works much better alone, tell me what I need to do and then leave me alone and let me do it, then home care might be a great opportunity for you. Some of you are young and looking for opportunity for advancement. You want to move up. Well, certain settings are not going to have opportunity for advancement, and you need to know that going into it. Make sense? Now, some of you are perfectly okay with that. Just let me punch my time clock, do my job, and go home. I don't want responsibility. Well, you would need to know what settings are good for that. Okay, so finding a job is more about you than it is about the job. Does that make sense? because every single place you go to work is going to have a different requirement of you. So I created this quiz. And this is a very quick 19-question quiz. It takes less than 5 minutes to do. It is personality based. And you answer these questions and it's going to sort you into one of 9 different healthcare settings. It'll tell you where your best opportunity to thrive is. Now, you guys have all this on that blue paper. It's at the bottom. There's a QR code at the bottom of the blue paper. The workplace, it should be, is it on there? Workplace personality quiz? No? Okay. It will be in your wrap-up email today. I'll give you a link to that. But you can also get to it right here. Your ideal workplace. This quiz took me 2 years to develop. There's a ton of psychology in it. I tested it on several thousand current healthcare workers that are already working in the field. And almost every one of them reported back to me that it sorted them into the place they're currently working. It's accurate. It's scary accurate, but it'll help you. Now, why is this important? You guys spent a lot of money to be here. You're spending a lot of money on the test. And what will happen when you first start working, that first job is going to make or break you. This happens all the time. You get into healthcare, you work so hard to get there. You're so proud of yourself. You get into your first job and you picked wrong. It is the wrong setting for you and you leave healthcare. You don't leave the job, you leave the industry. And now all of that money and all of that time was wasted. I don't want that to happen to you. I want to stack the deck in your favor so you have the best opportunity of success. Now, by saying this, though, if you get into that first job and it is not for you, it's not the right place, leave the job. Don't leave healthcare. Don't leave the industry. Find a new job to be a CNA. Good? Not all CNA jobs are equal. They are not. Find a new setting that's more in line with you and your needs and personality. Good? All right, before we get into our review, and I'm going to go through this very, very, very quickly, I would like to take just a moment of silence for the medical life that we lost this weekend in Minnesota, in Minneapolis. So I would like to take a moment of silence just to honor the sacrifice of the healthcare professional and his role in helping others. So Alex Preddy, this is for you. Thank you. All right. So we are going to do a very, very quick review now. I'm going to go through these. I won't prompt you like I have been doing. You should know these. You should be able to, in your mind, repeat after me. But we're just going to run through these very, very quickly. But I do want to remind you that if you're looking for a comprehensive review before test, it's going to be at 9:20 on class 7. This is where you want to go to in the replays. 9:20 on class 7 will be your comprehensive review. All right, so as a CNA, we follow the skill rules. That's the care plan, the whole care plan, nothing but the care plan. We observe for abnormalities and we report everything back to the nurse. If we know it, they know it. Every skill starts with an opening and every opening starts with a knock. Once we've knocked, we're going to greet the resident and address them by name. We're going to introduce ourselves by name and title, describe the skill that we're doing, and get permission. Once we've done that, we can close the curtain, go wash our hands, and then get our supplies. Do not touch that patient until your hands are clean. When we're getting supplies, we have to think about gloves. Not every skill requires gloves. Gloves aren't based on the skill, they're based on the patient. So we are going to wear gloves regardless of skill. if we're going to touch body fluids, personal skin, or non-intact skin. And if you're going to wear gloves, the first thing those gloves should touch is the patient. Keep your gloves clean for your patient. Once you've touched that patient, your gloves are now soiled. Be careful what you're touching in the environment. Pay attention. Don't spread those pathogens around. And then remove those gloves correctly by pinching up and then going under. If we're going to use supplies, we need a clean place to put them. That's where the barrier comes in. It provides a clean place to put our clean supplies. We only touch supplies with clean hands, and we don't hold supplies up next to our uniform. Because we're not holding supplies next to our uniform, we have to have two hands to spread out our barrier. So we get the barrier first, put it on the table, go back and get our supplies, and then put those on the barrier. One of the supplies we might have to get is a privacy blanket. We're going to use this anytime our patient is uncovered or undressed. It's there to keep the patient private, but also to keep them warm. We're going to put the blanket on over, don't snap it or shake it, and pull the sheet down underneath so your patient is never completely exposed. Should I ever see knobby knees? Okay. And then at the end of the skill, if we're wearing gloves, take the gloves off before you pull the sheet back up. Linen rules are going to apply to all linens, whether it's sheets or towels or washcloths or clothing or anything. Linens cannot touch our uniform. We already know that one. We have to have clean hands to get our linens. We already know that one. Don't snap or shake linens. We already know that one. Clean rolls toward me, dirty rolls away. We use this every time we put something under our patient. Don't let anything touch the floor. Not clean, not dirty. Nothing touches the floor. And anything you take and don't use has to be discarded. When we're talking about doing skills on patients in bed, there's some rules here. The patient must always be in the middle of the bed. You cannot rely on side rails to keep your patient safe. In fact, you're not going to have side rails in all settings. So in order to keep the patient safe in the middle of the bed when they're on their side after the turn, they have to be in the middle of the bed. So the way we do that is to scoot them toward us and roll them away. That way, after the turn, they're in the middle. Always roll a patient away from you or remain behind their behind. Okay. At the end of the skill, take a look at your patient. Are they in the middle of the bed? That should be your primary goal at the end of the skill when you're looking at your patient. Do they look safe? That's part of the closing. Now, we have a lot of washing skills. We've learned a lot of, and we're going to learn another one today, a lot of washing skills. So washing skills, we don't add soap to the basin because we have to have water for rinsing. So basins are no soap zones because whatever we wash, we have to rinse. Whatever we rinse, we have to dry. We're going to use a paper towel to turn the faucet on, check the water with our wrist. It should feel warm, not hot, not cold, just warm. Who else checks it? The patient, always. If we're going to wash a wet body opening, like mouth, nose, eyes, genitals, rectal area, wounds, rashes, sores, or incisions, we are going to use the leaves method. So leaves method for wet body openings. Don't get your surface wet. So make sure you're protecting the table with a barrier if you're working with water. If we're working on the patient in bed, protect the bed. Towel, chuck, something, protect that bed. And then if we put lotion on, we're going to warm it up before we use it and then wipe off the excess after. Basin cleaning, everything that holds liquid has to be clean. For the test, it's rinse it, dry it, store it. They don't care how you clean it. Rinse it, dry it, store it. But if you do have to disinfect in a clinical setting, please remember you cannot hold a basin while you're disinfecting it. You have to set it down to disinfect it, and then you have to use a paper towel to turn the faucet on. Sorry, I just zoned out there. A paper towel to pick the basin up. That's it. Paper towel to dry the inside, one to dry the outside, and one for the drawer. When you put those supplies away, your hands are dirty. The drawer is not. So please use a paper towel to put your supplies away. Shoe rules. Anytime a patient's feet hit the floor, we have to talk about their shoes. Slipper socks are never enough. If you're going to use a gait belt, put it around the patient's waist over their clothing. check it with 4 fingers to make sure it's snug enough so the patient doesn't slide right out of it. We're going to count to 3 before we lift them, making sure their feet are flat on the floor before we lift them. After we lift them, you want to give them a moment to acclimate and before you start walking. Ask them if they're dizzy, how they feel, and then once we return a patient to a chair, or if we're transferring a patient into a chair, they need to know that chair is behind them before we sit them down. So ask them, can you feel the chair behind your back? And make sure you're using proper body mechanics when you're lifting and transferring patients. Back injuries are unbelievably common for healthcare workers, way too common. And then every skill ends the same way. Good morning. Every skill ends the same way. Patient needs to be in a clean and safe environment. The bed needs to be in the lowest position, and we want to ask about comfort. They need to hear that word. We're going to offer a magazine or address preferences. We're going to adjust the head of the bed if they request it. You can ask if you want, but it's not required. But if they say, hey, can you lay me back down? Lay them back down. It's their right. We're going to give the patient their call light and instructions. You're going to open the privacy curtain. I don't care how you do all those things. Just get them all done. Comfort curtain, call light, clean. Once you get all of those things done, then you're going to go clean your hands. After you've cleaned your hands, then you can document if you need to, and then clean your hands again, because our cardinal rule here is we end skill with clean hands. Now, somewhere in there, I want you to stop and look at that patient. If that were your loved one in that bed, how would you want them treated? It's a really good rule of thumb. Treat your patients the way you would want to be treated if you were the one in the bed. I think that that's just a good rule to live by all the time. Not just with healthcare. Treat others the way you would want to be treated, because you will be a patient at some point in your life. You will be a patient. How do you want to be treated when you're the body in the bed? Good. All right, so pulse. Pulse is a measurement of how many times a heart beats over 1 full minute. You don't have to measure for a minute all the time. You're going to go by your care plan. But the pulse report is always over a minute. So if you're counting for less than a minute, we got to do some multiplication to get that minute reading, right? Our care plan for the test is going to tell us 1 full minute, so no multiplication required. You're going to count for 1 full minute. The pulse is located, the radial pulse is located at the top of the thumb side of the wrist. We use 2 fingers, the tips of the fingers, not the flat part, on the pulse. Put your thumb on the back. Look at the clock. Say start out loud, so the evaluators start when you do. And count the thumps you feel under your finger until the second hand gets all the way back around to that starting point, and then you say stop. This is a documentation skill. You do have to document. Dressing a resident. Ask them what they want to wear. They have the right to choose their own clothing. This isn't a dress up doll thing, okay? These are adults. Treat them like adults. I'll tell you a story about this, and very few things get me angry in life. This did. This is in one of our local assisted living facilities, the dementia unit, the locked dementia unit. Even if somebody has dementia, that doesn't mean they don't have dignity. These 2 CNAs that were working in the dementia unit overnight, this is several years ago when that Trolls movie was out, they brought in colored hairspray and put all the dementia patients' hair straight up with colored hairspray and treated them like troll dolls. They are not there for your amusement. That was right here. God help those CNAs if I get a hold of them. You are there to help. Don't overstep your bounds. Be very careful with that. I am still angry over that. And Trolls came out, 10 years ago? They're not there to be your dress-up dolls. Get clothing first before you undress them. Your patient should never be completely naked. That's not dignity. Be careful there. Make sure you're using a privacy blanket, privacy curtain, keep them covered as much as possible, protect their dignity. Anything that we lift from below with a flat palm, and you support all joints while we lift. We're going to undress the strong arm first, dress the weak arm first, and make sure all the clothing lines up appropriately. So all the snaps are lined up right, all the buttons are fastened appropriately, the pants are over the hips, toe seams along the toes, make sure they look good. Don't overextend or force movement, and make sure the gown goes in the hamper at the end. Don't just leave it on the end of the bed or on the table. Take care of it. And then the call light's going to go in the stronger hand. Hand and nail care. We're going to keep the nails clean and filed. That's really our whole purpose here. So we're going to support the wrist and arm at all times. We're going to put the hand in the basin to soak, take it out to wash it, put it back into rinse, take it out to dry. Supporting the arm as we move it. Anytime it's out of the basin, it must be on a towel. Use an orange stick, the slanted end, clean under the nails, wiping it off in between. Use an emery board to file the rough edges toward the center. Apply lotion last. Wipe off the excess lotion. Mini-manny, super easy. Making an occupied bed, we're changing the sheets a half at a time. Patient needs to be on their side in the middle of the bed while we change that bottom sheet. So scoot toward me, roll away once they're in the middle. We're going to take that bottom sheet, roll it toward the patient, tuck it under them, put the new sheet on, roll it toward us, tuck it under the dirty. Turn them back on their back, go around to the other side of the bed, repeat. Put the top sheet on, make your hospital corners, or at least get the corners off of the floor. Change the pillowcase. Limit the amount of time your patient is without a pillow. They should remain covered during that skill. Good? Side lying position, one of my favorites. This is turning a patient on their side, propping them there with pillows. So again, we're going to have them scoot toward us, and then we're going to position for the turn because this patient can't help with the turn. So furthest arm up, closest arm crosses, closest knee bent, furthest knee angled. Okay. So up, over, bent, angled. Once you get them in that position, it takes no effort at all to just plop right over. Once you get them in that position on their side, we've got to use some pillows to keep them there. So one in a roll behind the back, one between the knees. Make sure the knees are offset just a little bit, not on top of each other. One under that top arm to support it, and the last arm goes under the pillow, under the head. Call light in that bottom hand. Make sure they're in the middle of the bed. Foot care, just like hand and nail care, a little lower, nothing with the toes. So we're going to take the foot, put it in the basin to soak, take it out to wash, put it in to rinse, take it out to dry, providing support. And anytime it's out of the basin, it has to be on a towel. Same as hand and nail care. We don't do anything with toes. We're not going to clean them. We're not going to file them. We're just going to look at them. The whole purpose here is to look for abnormalities. We're going to apply lotion last, warming it up, putting it on, not between the toes. Wipe off your excess, put the sock and the shoe back on, clean up, you're good to go. Mouth care. This is brushing teeth. You all know how to do this, I'm sure. You're going to make sure the patient is in a full upright sitting position for this. Towel over the chest before you start. Wet your toothbrush, put some toothpaste on it. Little bit is all you need. And brush. Brush. Top, bottom, front, back, tongue, brush. Let them rinse and spit as much as they need to get that toothpaste out. Leave their mouth clean and dry. Clean up. That's all you have to know about mouth care. Respirations, don't tell them you're counting them. Vital signs is what you want to say here. In and out counts as 1. Normal is between 12 and 20. You can be off by 2 breaths in either direction and still be okay on this. That's a huge margin of error, guys. Huge, huge. You should not be failing respirations. There is no reason to fail respirations unless you're counting the pulse. And in that case, we're not following the care plan. And that's what's failing you, not following the care plan. Starting to see that secret? Remember on day 1, I told you in the first 15 minutes that you had enough information to pass a state exam? You guys remember me saying that? And you were like, no, I don't. No, I don't. You actually did. because all you have to do is read that care plan and do exactly what it says. And if you've noticed, that's exactly what we've done. Every single skill. We read the care plan and then we did exactly what it told us to do. That's the secret to passing the test. All right, so we're not going to tell our patient how to breathe either. That's important. Normals between 12 and 20. We're going to pick a starting point, say start out loud, so the evaluators count with us. We're going to count the breaths that we see up until the second hand goes all the way around, and then say stop out loud. This is a documentation skill. Range of motion, we've learned 3 range of motions. We learned shoulder, we learned elbow and wrist, and we learned hip, knee, and ankle. They all follow the same formula. Support from below, we've heard that before. Don't overextend or force movement. We've heard that before. Make sure you're moving slowly and smoothly all the way to start. Follow the care plan. Flexion extension is up, down. Abduction, adduction is side to side. Rotation is around and not on the exam. Don't get fancy. When you go take the test, don't try to show them that you know more than the care plan is asking you to do. We don't do extra. There is no extra credit, because if you're doing something that's not on the care plan, you could hurt the patient and you will fail because you're not following the care plan. That's right. Correct. All right. Remember, CNA is nothing more than Simon Says. Okay. But instead of Simon, it's the care plan. Denture care, mouth care with an extra step. So we're going to clean the dentures, then we're going to come back and do mouth care. To clean the dentures, you want to line the sink with a washcloth or something soft. Over the drain is even better because it lets the water pool up. Dentures always have to be in your hand, in the cup, or in the basin, nowhere else. Don't set the dentures down anywhere else. You're going to brush the dentures with toothpaste, all surfaces, rinse them, put them in a cup filled with clean, cool water on a paper towel on the bedside table. Then you're going to take those gloves off and do mouth care with new gloves. That's denture care. Ambulate with a gait belt. You guys starting to see how much we've learned? Ambulate with a gait belt. Pay attention to your patient. That's the main part of ambulate. You're helping somebody walk, but you're there to watch. If they start to get a little wobbly, get them sitting on the floor. Do not rush them back to a chair. They're not going to make it. They're not going to make it. Get them sitting on the floor safely and then call for help. Okay. When you put the gait belt on, it goes over the clothing. We want to check it with 4 fingers. We're going to use that gait belt to lift our patient to a standing position, holding at the sides or the back of the gait belt, maintaining our own body mechanics as we lift. We're going to let the patient lead, and we are going to watch the patient. That's where your focus is. We're going to return them back to the chair, make sure they can feel the chair behind them, help them sit down, remove the gait belt, make sure that they're sitting appropriately, and end your skill. Partial bed bath. Don't cross-contaminate here. We want to use leaves method on the face. Those are wet body openings. So we're going to use one leaf to wipe one eye, inner to outer corner. Other leaf to wipe the other eye, inner to outer corner. Third leaf for the face. Fourth leaf for the nose. Just don't cross-contaminate. Face first, no soap. We're washing face to waist, front, and back. We're going to dress them in a new gown because a clean body deserves clean clothes. We're going to give them a little back rub. So warm the lotion up. Little back rub up to the shoulders 3 times, little circles up to the shoulders, and wipe off the excess, tie your gown, clean up. Partial bed bath. Longest skill, 19 minutes. Transfer from bed to wheelchair. Wheelchair has to be close. If you think it's too close, it's probably not close enough. Close, because this patient cannot take steps. Remember, our care plan tells us they cannot take steps. So we want to lift the patient, turn them, and the wheelchair's got to be right there. They've got to feel it behind their knees so we can sit them down. Wheelchair has to be locked during transfers. The foot pedals and leg rests need to be out of the way during transfers. Once the patient is in the wheelchair, we're going to take the gait belt off, bring those foot rests and leg supports and foot rests back forward, and make sure that they're supporting the feet to help prevent swelling and blood clots. Anytime we walk away from a wheelchair, it should be locked. Good? Don't pull a gait belt against the skin. Feeding a patient. Safety and socialization are your two main goals here. Patient has to be sitting fully upright. Our care plan is going to tell us they're not, so you've got to fix that. We're going to offer a hand wipe and clothing protector. We're going to sit while we feed them. We'll offer a drink before feeding every 2 to 3 bites. Spoon should only be half full. They're going to refuse after the 4th bite. We're going to provide encouragement. After we feed them, we're going to clean up, wash our hands, and document. This is a documentation skill. Make sure you leave the area around the mouth clean. Pericare. We're going to use that leaves method again. We're going to clean down the center, fold our leaf, outside, fold the leaf, outside, fold the leaf, skin fold the leaf, skin fold. Whatever we wash, we rinse. Whatever we rinse, we dry. This is a one-way trip, top to bottom, never go back up. We're also going to clean the back side because they've been laying in urine. We also have to change the chucks out twice, once for them and the second time for the next 2 hours. Pericare is done every 2 hours around the clock. Yeah, we're waking them up at 2 a.m. We are. Absolutely. If you leave that patient laying in urine for hours and hours and hours, that acidic urine is going to eat the skin. All right. So it took us 20 minutes to review 24 hours of content. If anything that I said sounds foreign to you, if you're like, I don't remember that, that means you need to go back and review. Okay. You guys should have been rolling your eyes about halfway through. All right. So now we're going to help a patient with a bedpan. It's on page 147 of our book. You can see the principles down the side, our skill-specific steps. All the principles are detailed there for you. The bottom of the page, you're going to see skill or test-specific information. Somebody with your level of experience, which is none, should be able to help somebody with a bedpan within 10 minutes. 10 minutes. And this is going to be done on a live testing student. That means one of you might find yourself on a bedpan for the test. But before you freak out, let me explain this. You are going to remain fully clothed. You are not removing anything. If you are selected to be a patient for this skill, you're going to stay in your clothing and they're going to put a patient gown on over your clothing and lay you in bed. So this patient is in bed for this skill, and we're going to help them with a bedpan. So that means that for the test, somebody's going to be putting a bedpan under you and taking it out from under you, but you're not actually using it. It's a simulation. So if you are performing this skill as the CNA, it's going to be empty, your bed, but you're going to pretend like it's not. Okay. Good. And that's because mannequins don't lift their hips very well. So it's really hard to demonstrate this on a mannequin. You really do need a live person for this particular skill. All right. So page 148 at the top of the page gives us our care plan and our step-by-step instructions. And down at the bottom, you can see your supplies. For this skill, you're going to need 2 chucks. One as a barrier on the table and one under the patient, just in case that bedpan sloshes or spills. So 2 chucks. If you go back and watch my prior videos, the ones before when I'm in the blue scrubs, so blue scrub video for this, you will see that I do not use the table for this skill. Now, I use the table for every other skill that has supplies. But for this one, I did not use the table. And that's because I personally have an objection to using a toileting item on an eating surface. Even with a barrier, that's really high on my gross meter. Okay? That should not happen. But Because the checkpoints are so specific on this, the new videos, you do see me use a barrier on the table and I put my supplies on the barrier. I don't like it. In a clinical setting, I would not be putting a bedpan on a dining room table, which is what this is. I would leave the bedpan in the drawer until I'm ready to put it under the patient. It has a home. It's living nicely in its home. It doesn't need to be relocated from its home. So I'm going to show you the way that you need to do it for the test. We're going to learn that in class. That's what this is. It tells you exactly how to do it for the test. Put a barrier on the table, put your supplies on the barrier. That's fine. You're going to do this for the test. But I want you to go back and watch my older video to learn how to do it in a clinical setting, because I guarantee you've got patients out there like me that aren't going to eat after you've put a bedpan on their table. So you leave it in the, you just leave it in the drawer?
Okay, we gotta use that and take it again
And then put it right back in the drawer.
Clean it and put it back.
Yep, don't put it here. Don't put it here.
But for the test, we have to do it.
Yes.
Okay.
Yeah. They don't let me write the test standards yet. So I have no say in this, but to me, it's an extra layer of ick. Don't do that. Even with a barrier, it's still gross. All right, so here is our care plan. It says the resident has requested a bedpan. The resident is not wearing undergarments. Let's stop here. Let's highlight that or underline it. It says the resident is not wearing undergarments. It also tells us that the resident can wipe themselves. Let me explain to you why this care plan says this. Remember that you are going to be a patient for this skill. You are going to remain fully clothed, and you're going to have a hospital gown on over your clothing. The care plan says the patient is not wearing undergarments. So if you're performing bedpan, okay, if you're the CNA and you get this skill and you are her patient, you don't want her to pull your clothes off, do you? During the test. That's just going a little step too far, right? We're not that well acquainted. So the evaluator can now point to the care plan and say, this resident is not wearing undergarments. And that tells the student, do not take their clothes off. Same reason that we have the resident can wipe themselves, because we don't want you in her no-no square. Okay? Make sense? Good. It just gives that evaluator something to point to say, don't take that action, because we want to keep you safe when you're a patient for the test, as well as when you're the CNA for the test. So that line is actually for you when you're playing a patient. You guys see that? Okay. All right. It says the resident's able to move as directed. That's awesome. We can ask them to lift their hips. If they can't lift their hips, you would roll them on their side, push the bedpan up against their bottom and roll them back on the bedpan. When you go to take them off the bedpan, though, hold that bedpan flat, because when they roll off of it, if that bedpan isn't held flat, it's going to turn. You'll only make that mistake once, and then you'll learn. Ask me how I know. All right, so we know all these principles. There's nothing new to learn as far as principles. We're going to use these to create this skill. But we do need to learn the skill-specific steps here. So we're going to follow the care plan. We're going to do the opening. We're going to follow our glove rules. And yes, you do need gloves. There are body fluids here. We're going to use a barrier. We're going to make sure our patient's in the middle of the bed. We're going to clean the base in the same way and do the closing. We know all those. So let's learn about the bedpan. The first thing that you need to understand is that bedpans are a last resort. As a nurse, I have to go through every other possible option before I can get to bedpan. So ideally, in a perfect world, our patients are able to go to the bathroom by themselves. I don't want to be involved in that. You've been toileting yourself since you were about 3 or 4 independently. Don't need my help. I'm hoping you can keep that up. You're hoping you can keep that up because toileting is intensely personal. We don't like audiences, right? So in a perfect world, our patient would have something called bathroom privileges. Bathroom privileges means that they go whenever they want. That you guys all have bathroom privileges. You need to go potty, you get up and you go. You don't tell me. You're an adult. Take care of your business, right? Bathroom privileges. We aren't involved. But sometimes, because our patients are in a clinical setting, they might need a little help. So that would be bathroom with assist. They still go to the bathroom, but they might need some help getting there or might need some help while they're there, whatever they need. Give them the help. That's what we're there for. Those are ideal. That's what we're going for. But not every patient can make it all the way to the bathroom. It just, they're in a clinical setting for a reason. So in that case, I'm going to look at my next option, which is a bedside commode. It's a portable toilet. Kind of looks like a toilet. It functions kind of like a toilet in that it has a toilet seat. It has somewhere for you to go. You're in the right position, right? All those boxes are checked, but it's not as far as the toilet. Now, CNAs are responsible for cleaning these, emptying and cleaning them. But if the patient can't make it all the way to the bathroom, this is a good option because it gives the same toileting-like experience, but right next to the bed so they don't have to go as far. Awesome. They might do this independently or they might do this with assist. So, perfect world, we have bathroom with or without assist. Next step down is bedside commode with or without assist. If those two things don't work, now I've really got to dig deep in my bag of magic tricks. So the first question I've got is, hold up, is this patient even continent? Because if the patient is incontinent, well, bathrooms don't matter. We're going to keep them clean and dry every 2 hours around the clock. We got a whole process for that. So if they're incontinent, this conversation doesn't need to happen. If they are continent, though, I only have 2 options left. If they can't get to the bathroom and they can't get to a bedside commode, there's only 2 options: catheter and bedpan. That's it. That's all I'm left with. So catheters I can only use if there is a legitimate reason to use a catheter. And can't get to the bathroom is not a legitimate reason to use a catheter. Pee can't come out is a legitimate reason. Or pee coming out could interfere with an incision or a wound or something like that. That's a legitimate reason. Can't go to the bathroom, not a legitimate reason. So the very last option I have there is bedpan. That's like way down on the list. Do you see how much work I had to go through to get to bedpan? Do not take this lightly. CNAs, unfortunately, out there start making this decision more than any other. I don't want to get the patient out of bed. It's too much work. I'll just give them a bedpan. Did you go through all of those options? Do you have the ability to go through all of those options? Are you allowed to make decisions? So be careful here. Don't make this decision on your own. Let me explain to you why bedpan is last on the list. You have been trained since you were about this tall. Don't pee in the bed. Don't pee in the bed. Don't pee in the bed. And certainly don't poop in the bed. Absolutely not. So just because I put a plastic pan under your butt does not mean that your brain is going to let you go. Because the lessons we learn early in life are the ones that stick with us. Do you guys remember that memory making factory thing? Right? These are memories that were made when our factory was brand new, state of the art. These are good quality memories that are going to stick around for the rest of our lives. And just because we tell you to go in a plastic pan does not mean your brain is going to let you go in a plastic pan. Now, on top of that, that's bad enough, right? On top of that, we are not in a private place. We have a roommate right there. And the only thing separating us from a roommate is a curtain. If you think you have a hard time going in a public bathroom with a stall between you and your neighbor, imagine it being a curtain. How comfortable are you right now going to the bathroom in a bed with a curtain between you and your neighbor? That's good. Most of your patients will not be. Okay. So we've got the sound factor. Because when we put a bedpan under your undercarriage is only about this far from the bedpan. That's it. Now in a toilet, you've got quite a bit more space. So when you pee in a toilet, you don't get much splashback. But when you pee in a space this big, what are you going to get? Splashback. You got pee under pressure hitting a flat plastic surface. You are going to get soaked. This is not comfortable. Not at all. And then on top of that, we have odors to deal with. Because those curtains, they don't do anything for odors. Starting to see that this is not a good situation. When you put a bedpan under your patient, if they can't go, do not get angry at them. This may take 2, 3, 4, 5 attempts. We might put a bedpan under them, leave them for 10 minutes, come back and they're like, I just couldn't go. That's all right. We'll try again in a few minutes. Try it again. Do not get mad at them. This is very, very difficult from the patient's standpoint. Now, there are a few things you can do. Number one, get rid of the witnesses. If we have a roommate, if this patient is having trouble going and I have a roommate who is ambulatory, now is a real good time to take that patient for a walk. Get this one set up on a bedpan, get that one moving. Let's take a little walk, give them some privacy. This patient will probably go a whole lot better. Okay? Make sense? Second thing we can do, odors can be very sensitive. People will unconsciously hold stuff in because they're afraid of an odor coming out. So in that case, turn on the bathroom fan. Spray some poopery. Do something to help with odors. Good?
What if they're like allergic? Like some people are allergic to perfumes and stuff. Like
Well, you would want to check with your nurse to find out what we can use. And I didn't say air freshener because if your patient has a respiratory condition, we can't use air freshener. But poopery actually goes in the pan to help kind of protect against odors. Okay. We might want to run the water in the room because that helps with masking sound. But also the sound of running water triggers the urinary letdown reflex. If you've ever had to really pee and somebody starts talking about Niagara Falls, showers, rainstorms, your brain, that thought of the sound of water will really ramp up your need to go to the bathroom. So running water can help. And you can even get a basin of warm water and have your patient put their hands in the warm water, and that will also help with the urinary letdown reflex. So these are all really good tips that we can use to help our patients, but it's important that we understand this is not the simple act that you think it is. It's also our last resort. So please do not change the care plan. If the care plan says bathroom with assist, the care plan means bathroom with assist. It's not up to you to change to a bedpan. If the patient can't make it to the bathroom, what are we supposed to do? If you don't think they can make it to the bathroom, if our care plan says bathroom with assist and you don't think they're going to make it, tell the nurse. Absolutely. That's something they need to know. Starting to see how easy that written test is going to be? We don't think. All right, so our patient can move as directed. So we're just going to ask them to lift their hips, or you can ask them to roll over. But for the test, ask them to lift their hips. Makes it so much easier. Everything is easy here. And that is a graded checkpoint. We're going to put a chucks underneath them. Remember, clean rolls toward me. Have them lift, unroll that chucks under them. That's a graded checkpoint. We've got to protect the bedding. We're going to place the bedpan under the patient. The wider end of the bedpan goes under the widest end of the patient, right? If it looks like a toilet seat, it's where the butt goes. Imagine perching on this. Not comfortable. Not comfortable. We're going to remove our gloves because those are butt juice gloves now, right? You just put your hands under a bare butt. Those are butt juice gloves. Do you want to touch that bed controller with butt juice gloves? No, so take those gloves off. Put the head of the bed up. Patients have to be in a normal sitting position to urinate. So let me show you what I mean by that. If we have a patient laying in bed and I put a bedpan under their bottom, what does that do to their bottom? Lifts it up. How many of you ladies can pee uphill? It's what I'm asking them to do. What I need to do is get them into a normal elimination position. So head of the bed up, the most important step of this skill. They're not going to be able to go like this. And if they do, that pee is going to go right up their back and into their hair. Talk about gross. So when you put a bedpan under a patient, we have to put the head of the bed up. It's non-negotiable. But after they've used the bedpan, they're sitting on it now. They're pressing it down into that mat. You can't pull that out from under them. You've got to put the head of the bed back down to be able to get that bedpan out. You guys understand the mechanics there? Head of the bed, most important part of this skill. Hands down, most important part of the skill. Adjust that head of the bed. But I don't want to touch that bed controller with butt juice gloves. So take those gloves off. Now I'm going to tell you something that's really going to blow your mind. Remember I said that testing is minimum competency standards, like set your ideals very low. Yeah, well, they don't even require that you have gloves on to put the bedpan under the patient.
Well, we need to.
Absolutely, you need to. Absolutely. But it's not a graded checkpoint. Yep. Yeah, this is personal skin. You should have gloves on, but it's not even graded. Isn't that crazy? That's crazy. All right. Once we get them into a sitting position, we are going to give them the call light and toilet paper because the care plan said that they can wipe themselves. So we're going to give them what they need to accomplish that. In a clinical setting, I'm going to tell you that their undercarriage is only this far from the bottom of the bedpan. They're probably not going to be able to wipe very effectively. There's not much space there for wiping. You're probably going to have to help them after you take the bedpan away, but not for the test. Test says they take care of it themselves. All right. So we're going to put the head of the bed back down so that we can get that bedpan out because they're sitting on it. And when we take that bedpan out, we're going to take the chucks and the bedpan together. And that's because I can't carry an open container of urine anywhere. That's just gross. Don't do that. If you trip on your shoelace, you're going face first into a lake of urine. So the bedpan has to be covered. So we're going to take the chucks and the bedpan out together, wrap the chucks over the bedpan, and then we're going to take it to the bathroom. We'll dump our pretend urine, because remember, there's nothing in there. Dump the pretend urine in the bedside commode. And then we're going to rinse and dry and store the bedpan like we do everything else. Now, your patient wiped themselves. I know they did. The care plan told me they did. So
What are we going to do with the commode?
you don't do anything with a commode for the test.
Okay.
Just it takes the place of a toilet.
So we don't do anything like naughty, like when are we working? What do we do with
In a clinical setting, you're going to be dumping it into the toilet.
Yeah.
But in the test, they're using a bedside commode as their toilet. Okay, good question. So once we have rinsed, dried, and stored that bedpan, and we know the patient has wiped themselves, they probably need to clean their hands, wipe their hands. So we're going to give them a hand wipe after we store our bedpan. Now, there's another way of cleaning bedpans in a clinical setting that I wanted to bring your attention to, and this is a bedpan cleaner. It's if you go into a hospital, a rehab, some nursing homes, looks like a little tiny shower head. If you bend that forward, it'll spray down into the toilet. It is a bedpan cleaner. That's what it is. That's what it does. It allows you to clean the bedpan right over the toilet, dump it into the toilet. The toilet flushes automatically. It's a great, great cleaning method. But here's the problem. We have pressurized water hitting a flat plastic surface. We're going to get splashback. So we want to dress for the job. Now, this will help you clean bedpans beautifully. It does a great job. I don't want you to not use it. But if you're going to use it and we know splashing is going to occur, we want to cover our uniform with a disposable gown so that we don't get feces or urine on our uniform. And you want to cover the holes of your face because you don't want some stranger's urine in your eyeballs. So you're going to use a mask and shield on your face, and you're going to use a gown over a disposable gown over your clothing to use a bedpan cleaner. No, it's for your, no, actually, you're going to use this more for bowel movements than you will for urine. Yeah. So give them a hand wipe. Now, I know where their hands have been. So when I give them a hand wipe, I don't take that hand wipe with my hand. I get a paper towel to collect that hand wipe. I'm not touching that hand wipe.
I want to touch it with gloves. Why would I even touch the paper?
Sure. I mean, you can touch it with gloves, but you don't have gloves on right now.
I mean, we can wear gloves back, so is that
You can, but you can also just grab a paper towel.
okay? I can just wash my hands after.
And yeah, you're definitely going to wash your hands after. Absolutely. But just grab a paper towel. There's no sense in grabbing a whole new set of gloves just to collect a hand wipe. Grab a paper towel. Does the same job. All right. And then you're going to do your closing, wash your hands. There's no documentation for this skill. So let's put all of these steps together and check off our checklist. Guys, this is your checklist for this skill. You have 10 minutes to get this skill done. The checklist looks impressive. There's a lot of steps here. But let's take a look at this and break it down. We're going to follow our care plan. We're going to do our opening. We are going to use gloves for this one. We're going to use a barrier on the table. Patient has to be in the middle of the bed at all times. We're going to clean our basin like we clean everything else. And these are the steps of the bedpan. Not even, I would say about a third of the checklist is related to bedpan. Everything else is going to be covered by the principles we already know. So even though this is a really long checklist, it's not very hard. Good? Now, this care plan is only for this patient. Nobody else, just this one. Every other patient would have a different care plan for toileting needs. Some of them will be bathroom. Some of them will be bedside commode. Some of them will have a catheter, which we're going to learn in just a minute. Every patient will take care of their toileting needs differently. Now, toileting is one of the most important topics for CNA work because every patient on every shift in every setting is going to have to go to the bathroom. This is the one skill that you are guaranteed to have to help patients with is toileting. Okay. So this is one that we've really got to understand. There's a lesson in your book on page 115. This is a lesson I would advise you to read. When you go to work at the beginning of your shift, you are going to take report from somebody that's going off of shift. They're going to tell you about your patients, how your patients are, what to expect, what you have to do with each patient. They're going to give you a report. Well, these reports can be really, really all over the place, very convoluted. Information can get lost or missed or forgotten. So if we use a well-organized method, it keeps everybody on the same page. And that method is called the TEAMS method. TEAMS. This is specific to CNAs. TEAMS. T is for toileting. You need to know how every patient toilets. It's number one for a reason. Okay. E is for eating. Most of your patients are going to eat at least once on your shift. A is for ADLs. That's everything else that we have to do. M is for mobility. Now, mobility has its own special category because you need to know, does your patient get up out of bed? Are they on bed rest? What if they use the call light and say, hey, can you get me up? You need to know, am I allowed to do that? M for mobility. And then S is for special, anything that's not covered by those categories, like vital signs, daily weights, things to watch for. Patient fell last shift. Okay, so S is for special. But T is at the very beginning for a reason. Toileting. Everybody's got to go. All right, Jake, go ahead and throw our video on.
Hello.
Hi, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
I'm well. How are you?
Fantastic. I understand you need a bedpan. Can I help you with that?
Yes, please.
Okay, I'm going to close your curtain, wash my hands, get my supplies, and I'll be right back. After I've washed my hands, I'm going to get my supplies. I'll start with a barrier, unfolding it with the absorbent side facing up, and this is going to give me a clean place to put my clean supplies. And we're going to start with the chucks, and then I'll move over here to the patient environment. I need a set of gloves, a second set of gloves, hand wipes, and I'll need the bedpan, which will be in the bottom drawer. I'm going to open the drawer, but I'm not going to touch the bedpan until I put my gloves on. We'll go ahead and put the gloves on. I'll take the barrier and prepare it by holding it up with the absorbent side facing me, and I'm going to roll it toward me. And we're going to set that aside. I'll get the bedpan and the toilet paper out of the drawer, and we'll put those on the bedside table. Now we're ready to start the skill. Okay, Mr. Jones, I'm going to ask you in just a moment to bend your knees and put your feet flat on the bed, and you're going to lift your hips up for me so I can unroll this chucks underneath you. This is going to protect your bedding while you use the bedpan. Okay? So I'm just going to loosen this sheet up a little bit so we've got some working room. I'll take my prepared chucks, and we're going to place it on the bed where we're going to unroll it under the patient. It needs to be under the middle of the patient where the bedpan is going to go to protect the sheets from becoming soiled. Mr. Jones, can you bend your knees? And I want you to lift your hips as high as you can go. Thank you. I'll unroll that chucks all the way to the other end. Okay, you can relax. There you go. Now we're going to put the bedpan under the patient. The wider end of the bedpan goes under the patient's buttocks. So this will be toward the foot of the bed. Mr. Jones, can you lift for me? Thank you. Go ahead and come down. Make sure that that's centered appropriately. All right. And now I can remove this set of gloves. We'll throw these gloves away, and I'm going to put the head of the bed up. Mr. Jones, I'll put the head of the bed up now. That bedpan may shift a little bit. Feel free to move it as you need to and let me know when you're comfortable. And you can relax your legs. Are you comfortable? Okay. Here's your toilet paper. Here's your call light. I'm just going to step on the other side of the curtain and let me know when you're done. Okay, Mr. Jones, are you done?
I am.
Very good. Let me lower the head of the bed. There we go. And I'm going to put my gloves on. All right, Mr. Jones, in just a moment, I'm going to ask you to bend your knees and lift your hips off of the bedpan, but wait until I tell you because I need to hold that bedpan flat.
Okay.
Okay? I'm just going to move this out of the way. I'll take a corner of the chucks. Go ahead and bend your knees. Don't lift yet. I'm going to take a corner of the chucks and hold the front of that bedpan down as he lifts. Go ahead and lift, and I'll pull the whole chucks and bedpan out. Relax. And we're going to take this to the bathroom for disposal. I'll bring the bedpan over to the patient bathroom area. We'll unwrap the chucks from around the bedpan and dispose of the chucks. And then we're going to dispose of the contents of the bedpan into the bedside commode. For testing, this is a simulation skill. There will not be anything in the bedpan, but we're still going to follow through with the simulation. We'll lift up both the seat and the lid. We're going to dispose of the contents of the bedpan into the bedside commode or toilet. And then we're going to rinse the bedpan. We want to put the rinse water into the commode as well. Now I'm going to set the bedpan down into the sink, disinfect it per facility policy, and then use a paper towel to pick it up. I'll take a paper towel to dry the inside. Throw that away. Another paper towel to dry the outside. Throw that away. And then one more for the drawer. Now that I've cleaned the bedpan, I'll get the toilet paper, place it in the bedpan, open the drawer with the paper towel, and then we're going to position this bedpan in the drawer and close the drawer with the paper towels. I'll then throw these paper towels away. We're going to remove the gloves and throw those away. I'll get a paper towel. Mr. Jones, I'm going to give you a hand wipe so you can wash your hands after using the bedpan. Go ahead and take a hand wipe. And then I'll collect that hand wipe after you're done with the paper towel.
Thank you.
This keeps me from touching the hand wipe. We'll throw this away. We're going to throw the barrier away. Clean our work environment. So I'll pull the sheet up. Make sure that it looks good. And here's your call light, Mr. Jones. If you need anything at all, just press that red button and we'll be happy to come back and help you. I'm going to remove your bedside table and open your privacy curtain. Is there anything else I can get for you while I'm here?
No, thank you.
Are you comfortable?
Yes.
Would you like a magazine before I go?
No, thank you.
Okay, your bed is in the low position. Your environment is clean. I'm going to go wash my hands. After washing my hands, I'll review the care plan, think about my skill, make any corrections, and then tell the evaluator my skill is done. Ooh, your eyes. And ears. All right. Any questions on that? Yes.
Isn't it like it's gonna hurt the person's butt, like it being under and how hard it is?
Well, I wouldn't ever classify a bedpan as comfortable, but no, it shouldn't hurt. I mean, it's no more rigid than a toilet seat that you sit on. So
I mean, what if it's gonna break?
Yeah.
if you're concerned about it breaking, then who would you tell? The nurse. Yeah, if we have somebody who's 600 pounds, that bedpan is not going to be effective. We have something called bariatric bedpans, which are much larger, to fit the space. Okay. But that's a nursing judgment. Any other questions?
I think I missed the part where he cleaned after doing all this stuff in the bedpan. Like, how does he clean? Is it his job? We don't do anything with the cleaning?
What does our care plan say?
I think I'm like himself.
Yeah.
Okay.
So our care plan told us that he's going to take care of his own cleaning. We don't have to see it. We don't have to know about it. Care plan said that he's doing it. That's all we need to know. In a clinical setting, if we have to clean him up, then we're going to clean him just like we did with pericare, right? Same process.
Okay, so with the bedpan, they can clean themselves, and then when they get like regular bath, we have to wipe them.
No. This patient, this care plan can clean himself. It's not that patients with bedpans can clean themselves. Those are two totally separate things. This patient can clean himself. In a clinical setting, you will have patients with bedpans that can't clean themselves, and we will be responsible for doing that. We will use pericare techniques to clean.
Okay, so we don't remove the bedpan with the undersheet. We remove the bedpan separately, and we still use the sheet to clean them.
Every situation is going to be a little bit different in how you handle that, because every patient's going to have a different level of ability, a different situation. You really have to learn that per patient. Okay. So yes, some patients you would leave the chucks in place, take the bedpan out, clean them up, and then take the chucks away. Yes, that is a possibility. But in that case, you still have to have something to cover that bedpan as you're transporting it.
A paper towel or
Something.
Okay.
Yeah.
Okay.
Okay. But cleaning the patient is really going to be very patient specific. All right, so let's learn catheter care. This is on page 158. We know all the principles involved, and boy, are there a lot of principles. But you know them all. If you look at the bottom of the page, you'll see test-specific information. Somebody with your level of experience, which is none, should be able to do catheter care within 15 minutes. This is going to be done on a mannequin, and the mannequin will be laying in bed for this skill. No documentation is required. Page 159 has your care plan at the top of the page and step-by-step instructions. Supply list is at the bottom of the page. And here's our care plan. Provide catheter care with soap and water to a female resident with an indwelling urinary catheter. Clean the catheter tubing and peri area only. So that's telling us exactly what to do. We're just going to clean the tubing and the peri area. We are not cleaning their backside because the care plan did not tell us to clean their backside. Pericare, we did clean the backside because the patient was laying in urine. With a catheter, the urine is going into the catheter bag, not under the patient. So all we're doing is cleaning the peri area using pericare technique and cleaning the tubing that the catheter tubing that the urine is being diverted through. So if you remember pericare, we changed the pad under the patient to get them on a dry pad. We're going to come back to that in just a minute. We changed the pad under the patient to get them on a dry pad. Then we cleaned the peri area, middle, side, skin fold, whatever we wash, we rinse, whatever we rinse, we dry. Then we turned the patient over and cleaned the back side, up the middle, cheek, up the middle again, wash, rinse, dry. And then we change that chucks again so that at the end of the skill, a patient's on a clean chucks for the next 2 hours. You guys remember pericare? Catheter care, very similar. But instead of changing a chucks, we're simply going to put one there because they don't have one under them. There's no need for a chucks if the urine is going into a bag, not under them. So we put a chucks there for cleaning. We clean the peri area, we clean the tubing, and then we take the chucks away. That's it. It's actually easier than pericare because they don't have to turn the patient over. Good? Makes sense? All right. So ways that catheter care is different is we are not cleaning the backside and we're not leaving a clean chucks under them at the end. Let's talk about that chucks for a second. Chucks are plastic lined. They're going to hold in body heat. They're going to trap moisture against the skin. So we end up with warm, dark, moist. So if we don't need a chucks under the patient, we shouldn't have a chucks under the patient. So for this skill, we're not going to leave one there. Good? All right, so let's talk about catheters. So nurses, RNs and LPNs, insert catheters and take catheters out. This is not a CNA task. So a nurse would put a tube, it's a hollow tube, nothing more than a straw, a hollow tube into the bladder to divert the urine from the bladder into some sort of a collection device. That's what a catheter is. It's nothing more than a straw that we divert liquid through. So nurses do that. A catheter, when it's inserted, is smooth. Once we get it in place, we inflate this little bubble on it to keep it in place so it doesn't accidentally fall out. This, if I just let go, would slide out like a piece of limp spaghetti. It's not going to stay. We have to have something to make it stay. Do you guys remember anatomy that we talked about last class? Right? We have 2 kidneys. Those kidneys, where is it? Hold on. No, I don't have it here. Okay. We have 2 kidneys. Those kidneys produce urine 24 hours a day, drip, drip, drip. Those urine drops go down ureters into the bladder. They are held in the bladder because we have this little valve here. Well, all a catheter does is hold that valve open. That's its whole job. Hold that valve open and provide a pathway for the urine to get out. So what we want to do is inflate a doorstop to keep that catheter from sliding back out. And that's what that bubble does. And we just inflate it with water. So this is what a catheter looks like when it's being put in or taken out. It's smooth. And it actually, because I've inflated this a couple times, you can actually see it's actually smooth. It's more smooth than this. So this does not hurt. Once we get it in place, we've advanced it up through that valve, and now it's sitting in the bladder. Then we just inflate that little bubble with some water, and now it's sitting on top of that valve, and we can pull, and it's not going to come out. Now, if I pull hard enough, it will, right? But we don't want to pull hard enough, so we're going to be gentle with catheters, and that's part of what I'm going to show you for the technique. But that's all this is it's designed to just sit on top of that valve and keep it. If I didn't have that balloon inflated, And when I put it in, it would literally fall out. There's nothing to keep it there. Good? Questions? Okay, so these catheters are put into place while they're smooth by the nurse, and then the nurse uses a syringe to inflate the bubble once it's in place. And all that bubble does is keep the catheter in position. When we are ready to take it out, when we don't need the catheter anymore, we don't just pull it out because, ow, we would deflate that balloon, pull the water out of the balloon, and it slides right out. Good. I'll pass this around so you guys can see how that works.
But we're not gonna do anything with the catheter inserting or.
We don't put it in, we don't take it out. Not our job. Not our job. All right, what is our job then with catheters? Yeah, we're going to clean it. Yeah, that's our job. We're responsible for cleaning the catheter and the skin around it, usually once per shift. So how often did we have to do pericare? Every 2 hours around the clock. This is once a shift. Okay, whether your shift is 8 hours or 12 hours, once a shift. All right, the other thing that CNAs are responsible for with catheters is to make sure that the catheter and the tubing are positioned correctly. So catheter bags should be on a non-moving part of the bed. Remember, hospital beds move, right? We want it on a non-moving part of the bed. We also want the bag above the floor. Remember, nothing on the floor, nothing on the floor. We don't want that bag to touch the floor. We also don't want that bag above the level of the hips because that would cause the urine to run right back into the patient. And I don't know about you, but recycled urine, pretty high on my gross meter. Okay, urine really should be a one-way trip, out only. I don't want it back in. So catheters and bags. So what I have passed around is the catheter itself. That catheter is going to be attached to a bag of some sort. So you can see where the syringe is attached. There's another port. That other port would go onto here and create one system. This is a closed system. Now, the catheter and the bag have to be two separate pieces because the catheter can stay in up to 30 days. Okay, two separate pieces. Catheters can stay in for up to 30 days before they have to be changed. Bags, however, are usually changed once a week. So they have to be two separate pieces. CNAs do not change bags unless you have been trained to do so. It's something you are allowed to do after training, but that's not part of initial CNA training, okay? That has to be patient specific. I'll explain why in a few minutes. We also inspect the bag. We empty the bag. We document output. So we kind of work with the bag and the catheters, but we don't put them in or take them out. Questions on that? All right, so I'm going to pass this around. I'm going to pass this around again in a few minutes, okay? So right now, I just want you to kind of look at it and see it's got a port. In a few minutes, I'm going to pass it around. We're going to look at some other features. Okay, so we're going to review the chain of infection really quickly here. We went through this on class 2, which was a long, long time ago. But the main problem with catheters is something called a catheter-acquired urinary tract infection, or CAUTI. Patients that have catheters are at a very increased risk of getting an infection. And the reason they get an infection is because this is a closed system. So remember the chain of infection. we had a pathogen. That pathogen had to have a place to live, and then it had to find a doorway out, and it had to travel in fluid and find a doorway in, and the patient had to be susceptible. Do you guys remember that? Well, with a catheter bag, if we get a pathogen in that bag, that pathogen is looking for a way out. And the way out is to climb that tubing. And they'll keep climbing. And as they climb, they encounter fresh food because the enzymes and the proteins that they need to procreate are in urine. So they get fresh food and they really start to multiply. And as they multiply, they keep climbing and they keep climbing and they keep climbing. And they're traveling in fluid and they're looking for a doorway in. That doorway in is the opening at the top of the catheter, and it leads directly into the bladder. And along the way, it did not have to encounter any of our white blood cells. So these catheters allow these pathogens to do nothing but multiply with no resistance at all. They just multiply and multiply and multiply and multiply. And there's nothing to stop that from happening. So this is the slide I was looking for earlier. So if you remember, we've got two kidneys. Those kidneys filter blood, produce urine. That urine drips down ureters into the bladder. A valve holds that urine in the bladder. And all a catheter does, we're going to insert that catheter, blow up that balloon that holds that valve open and diverts the urine through the tubing. That tubing is going to be connected to some sort of a bag. We're going to talk about the bag in a minute because there's a couple different kinds of bags. If pathogens are allowed to get in here and they multiply, their portal of exit is going to be to climb the tubing. And then when they get into this part of the catheter, now we've blocked out light. So we definitely have warm and dark and moist from fresh urine. So they really ramp up and they really start to multiply. And by the time they jump out of the holes at the top of the catheter, they are in the bladder, and it's not 1 or 2 bacteria. It's 1 or 2 trillion bacteria. This patient goes from I'm fine to I am dying in like 30 minutes. Because it would be like all of Canada invading Spring Hill. If all of Canada came down and invaded Spring Hill, would we stand a chance? No. They're going to overwhelm us with numbers. That's what happens here. So when we have a catheter and we are responsible for cleaning it and maintaining it, it is super critical that we understand that we are what is standing between this patient and an overwhelming invasion. So clean is the name of the game with catheter care. Make sense? All right. So there's 3 places that these pathogens can enter. There's this up here, which the nurse is responsible for. She's got to keep this sterile while she's inserting it. So that's the nurse's problem, not us. This, where the bag and the catheter meets, I told you you can be trained to change bags, but that's not something you're going to do as a basic CNA. So not us. But we are responsible for emptying the bag. When we empty the bag, if we let bacteria into this bag, it could be game over for the patient. Now, it's the furthest away from the patient. So these pathogens, if they get in the bag, they got to work real hard. It's going to take a while. They got a long way to go, which is why these bags are usually changed once a week. You're starting to see why we have that time frame. If we get bacteria in here, it's going to take them a week. They're small guys. They travel slow. It's going to take them a week. So that's why we change the bags out every week. Now, the catheters themselves, we only change once a month because we have found that there's much more risk of putting pathogens directly in the bladder. All right, so catheters should hang from a non-moving part of the bed. They should never, ever, ever touch the floor. Do not raise a bag above the level of the hips because that allows urine to flow right back in. But this is probably the biggest danger that we have with catheters. Do not allow the tubing to be coiled near the floor. Your feet or a visitor's feet or another staff member's feet can get all tangled up in that tubing. And when you're trying to untangle yourself, you'll pull that catheter right out. Yeah. Yeah, patients pull catheters out. They do. They do, especially when they're confused. Patients will pull a catheter. Don't panic. It's fine. They'll be fine. Yeah, you'll probably see a little bit of blood because that balloon, you guys saw how big that balloon is going through a space about this big, right? That going through that, you're going to get some tissue tearing. They'll be fine. It's okay. They'll heal. It's all right. Don't panic, but don't hide it. And don't throw it away because the nurse needs to look at it. As the nurse, it's my responsibility to figure out what kind of a problem I've got here. If the catheter came out and the balloon is intact and it's still blown up and everything is together, hey, that's okay. That's something I can deal with. But if it comes out and that balloon is deflated, that means that it burst inside. And a piece of that catheter may still be inside the patient. Now, the only way for me to know that is to look at the catheter. If you've thrown the catheter away and I don't see it, I don't know what kind of a problem I'm working with. Now, anytime you have injury, you always have swelling. If you slam your thumb in a car door, you'll know about swelling, won't you? Injuries cause swelling. So if we pull a catheter out, that's an injury. What are we going to get? Swelling. Is this an area that we want to swell? No. If you try to pee through that tissue, it is swollen and it's torn. What's that going to feel like? Oh, yeah, it's going to burn. It's going to sting. It's going to hurt. Patient's not going to want to pee. This is going to be bad, right? Probably for about 2 to 3 days, it'll be bad. Now, if the swelling gets too much, I'm not going to be able to get another catheter in. I've got about 45 minutes to make a decision. So if patient pulls catheter out and you go to lunch and come back 2 hours later and let me know, oh, yeah, I forgot to tell you, Mrs. McGillicuddy pulled her catheter out, I have no options because now the swelling is to a degree that I'm not going to get another catheter in. This patient is stuck. Nothing I can do about it because you did not tell me what was happening with my patient.
Well, what if we you gotta give us 45 minutes with after he took the catheter off, but what if you're taking care of other patients while we don't look at him because we just cleaned him and we went to look at the other patients that we need to take care of and it's gonna take more than 45 minutes and what are we gonna
Right. So if you come into the room and the catheter is laying on the bed like this and you have no idea how long it's been out, you just tell me. I found the catheter. I don't know. I last saw her 2 hours ago. I don't know when she, I'll take a look. Remember, I assess. That's my job is to assess. Your job is to let me know there's a problem when you find it, not 2 hours later. Okay. Does that make sense? Good. So I need to know when a catheter is pulled out. The sooner I know, the more options we have. Now, in a perfect world, I'm probably not going to put another catheter in this patient because if they pulled one out, they're probably going to pull more out. They don't want it there. That's no problem. And as long as I can make that work, that's the option I'm going to go for. Yeah, it's going to sting. It's going to burn, sure. But if I put another one in and he pulls it out, we're going to have twice the problem. So that's not a good solution either. So I've got to make some decisions here. In a perfect world, I'll leave the catheter out. We'll wait for it to heal and move on. But what if this patient has a huge tumor in the area that prevents urine from coming out? At that point, I have no choices. I have to put a catheter in because that's the only way the urine's coming out. Make sense? Okay. Or if the patient had a spinal cord injury or disease like multiple sclerosis or spina bifida that prevents signals going from the brain to that valve, and that valve is permanently closed, I've got to put a catheter in. So in that case, we're going to look at behavior modification with the patient. Your job is to report what you see. My job is to take that information and figure out what to do with it. You guys understand the roles there? So those of you that are in nursing school, are you starting to see how much you have to learn? Okay. You have to learn all of the variables. So take this situation. There are about 200 variables here that I have to consider. Does the patient get out of bed? Is the patient able to urinate? How often do they urinate? Do they have a UTI? Are they pulling out the catheter? What is their mental status? All for this one little tiny problem. Okay. I've got to run through all of the scenarios and find the best solution based on that information. But as bad as that is, right? Patients pulling out their catheters, that's bad. We don't like that. But that's actually not the biggest risk. The biggest risk is us. We pull out about 4 times as many catheters as patients do. Us. Remember that tubing coiled near the floor? Yeah, that happens. That's real. But that's not the only danger. We get patients out of bed. We take them for walks. We put them into wheelchairs. We turn them over in bed. We are responsible for mobility. If our patient has a catheter and we stand them up and start walking and forget to bring the catheter with us, what's going to happen? Yeah, we're going to pull it out. If we go to turn a patient over in bed and we lean against the bed with our legs and we trap that catheter tubing between our leg and the mattress and we turn the patient, what's going to happen? We're going to pull it out. We pull out about 4 times as many catheters as patients do. So this is why it's super important. Remember, T is always first, toileting. That's the first thing you need to know. Does your patient have a catheter? Because everything else that we do is going to have to be accommodating to that catheter. If you have to turn a patient every 2 hours, you've got to know, do they have a catheter? If you're going to walk the patient, do they have a catheter? Even, are you going to feed the patient? Do they have a catheter? You need to know about that catheter because it's going to affect how we handle our patients.
What did you do for the first time when you pulled it out?
First time I pulled a catheter out, I cried because I knew how much it hurt the patient. And it was all on me. It was my negligence that caused somebody else pain.
Like what happened? Like how did it happen?
What happened? Yeah. On that one, the bag was on the other side of the bed. I didn't get the fact that they had a catheter and report, and I didn't look. I just stood them up and started moving them. Yeah. And the patient's like, ow, ow, ow. And I'm thinking they've got a leg cramp. They're stepping on something, right? So I'm looking down at their feet trying to figure out, why are they owing? And then I see urine coming out. And I'm like, ow, urine, what's going on? And then I looked at the bed and I saw the catheter laying across the bed. And I cried. I burst out, I'm so sorry. Because I have just hurt somebody. My job is not to hurt. I want to heal. I got in this to help. Right? Yeah. Help isn't help if it doesn't help. All right. So when a patient or you pulls out a catheter, don't just throw it in a trash can somewhere. Go get an empty trash bag. There's always in the bottom of every trash can are empty bags. So go grab an empty bag. Put the whole contraption, the catheter, the bag, everything in that bag. Put it in the bathroom. That way the nurse can inspect it before we dispose of it. We probably are going to need to empty the bag and measure the urine too, if the patient's on intake and output. So just put the whole thing in a bag for the nurse to take a look at. And then they will give us further instructions from there. All right, so there's a couple different types of catheters when we're working with patients. Please remember, everything in healthcare has at least 2 names, okay? This, what I passed around, is called an indwelling catheter. We put it in, we inflate a balloon that keeps it in up to 30 days before it has to be changed. Indwelling catheter, also called a Foley. It's called a Foley way more than it's called an indwelling catheter. Foley. But we don't always need to leave a catheter in. We might just need to put a catheter in just to empty the bladder and then take it right back out. That's an intermittent, right? We're not indwelling, we're not leaving it in. We're just putting it in for a short time and taking it right back out. So there's no need to have something on the catheter that keeps it in place. It's what we're there for. So the nurse would put the catheter in, hold it, empty the bladder, and then remove it. That's what this is. This is called a straight cath or often an intermittent cath. And it's most commonly called a Red Robinson because the dude that created its name was Robinson. This guy, the dude that created it, was named Foley. Yeah. Invent something in healthcare, we name it after you. So this is just for single use, in and out. Then we have this. This is called a condom cath or a Texas cath or a male cath or an external cath. At least 2 names. Some things have more. But the most common name for it is a Texas cath. I don't know why. Can't tell you. Don't know. But Texas cath. This is an external catheter. It has the same port. See this? It's the same. It connects to a bag. But this goes on over a male penis. So it doesn't go in. This is external. It goes over. It's sticky on the inside to help hold it in place. But it is designed to be less invasive. So if we need to move urine away from the skin on a male and we don't want an indwelling because of the risk of infection, we can use this. Okay, good. It goes on just like it rolls up like this, goes on just like a condom does, and it's sticky, so it's designed to stay in place for 3 days before it has to change. But here's the problem with these. Because of the way it's put on, there's always this little gap here between the tip where the urethra is and the port that's going to pull the urine away from the body. There's that little reservoir, that little gap right here that's going to hold urine. That means that we're holding urine right up against that tissue. And adult urine is acidic. So when we change these, good male pericare is essential. We've got to clean that skin because this is not a place that we want a sore, that we want the acid to eat the skin. That would be extremely painful. All right. So when we're doing catheter care, we're going to do the pericare portion just like we did pericare for pericare. The only accommodation we're going to make is to hold that catheter so we don't pull on it while we're cleaning. So I'm just going to, with one hand, I'm just going to kind of hold that catheter up out of the way, and I'm going to wipe down the middle, fold my leaf, side, fold my leaf, side, fold my leaf, skin fold my leaf, skin fold. Whatever I wash, I rinse. Whatever I rinse, I dry. That's the only change that we're going to make to pericare is to hold the catheter while we're cleaning. And then we're going to shift downward strokes away from the urethra, 5 leaves, and try to prevent tugging, okay? Then we're going to move to cleaning the tube, the catheter tube. So again, I'm going to hold it where it exits the body to keep it from pulling on the inside. I'm going to take the washcloth, wipe it around the tube, and move away from the body. I'll fold that leaf, do it again, away from the body, fold that leaf, away from the body, fold that leaf, away from the body, holding that catheter in place the whole time. And we do this with 4 leaves, away from the body. Whatever we wash, we rinse, whatever we rinse, we dry. And then you take the chucks away, clean up. So understanding about catheters is the hardest part of doing catheter care, is kind of learning about the catheters. So we're going to use, we're going to use these principles now that we know them and combine them with our skill-specific steps that we're about to learn to make this skill. So we're going to put a chucks under the patient because it's a graded checkpoint. We've got to protect those sheets. We're going to hold the catheter where it exits the body and use the leaves method to clean the inside of the peri area, 5 strokes. Whatever we wash, We rinse, whatever we rinse, we dry, and always wash top to bottom. These are your checkpoints for wash, rinse, and dry. Then we're going to clean the tubing, holding it and moving away from the body. Make sure that you don't tug on the inside. And we want to go down at least 3 to 4 inches. I usually just do the whole tubing while it's there. Then we're going to remove the chucks from under the patient. We don't want to leave the chucks under the patient. Check that bag, make sure it's hanging from a non-moving part of the bed and it's not near the floor and the tubing isn't coiled near the floor. So now that we know all the steps, let's see how we're going to check off all of these checkpoints.
So we're cleaning the tube too.
Yes. Yep. Peri area and the tube. Yep. All right. So we're going to follow our skill rules, do our opening. We're definitely going to need some gloves for this. We're going to use a barrier, privacy blanket to reduce exposure, keep the patient in the middle of the bed at all times. We're going to use our washing rules and our basin cleaning. And then whatever's left is skill specific. It's not much. Not much for skill specific here. A lot of the other skills we had, like 1/3 of it was skill specific. This is not much. And then, of course, we have to do our closing at the end. So you know 90% of this skill already. Remember, this skill is only for this patient, nobody else. All these patients, if we're going to do catheter care, our care plan may say something completely different.
So, like I observed that in Bedpan, where we didn't use a privacy blanket for the patient.
Yeah, because we kept them covered with a sheet because that was the checkpoint. I don't like that. I prefer to cover them with a privacy blanket, but for that skill, just keep the sheet on them.
That's the only thing that we don't do.
That's the only one we don't use privacy blanket for. Good point. All right, so before I show you that video, I want to jump into a drainage bag. I'm going to talk to you about the drainage bag. We're going to learn about it. And then I'm going to show you these 2 videos, one right after the other. Because when you do catheter care, usually you're going to empty the bag as well. They kind of go together. For the test, they're 2 separate skills. 2 separate skills. But I present them together because in a clinical setting, you're usually doing them both together. Okay? So we're going to learn about drainage bag, and then I'll show you both of those videos together. And then the rest of the class, I'll put you on break, but I'm going to sign off before we go to break. And the rest of the class will be practice. Okay, good. All right. So if you look on page 164, you can see the principles involved, skill-specific steps. Our principles are outlined here. Down here is your test-specific information. Somebody with your level of experience should be able to do this in 9 minutes or less. Mannequin will be in the bed. Charting is required. You have to be within 50 cc's of the evaluator's reading. If you look on page 165, you can see the care plan at the top, step-by-step instructions, supplies at the bottom. Here's our care plan. All right, empty the resident's urinary drainage bag into a graduate container and measure and record the urinary output in mLs or cc's on an intake and output form. That's our care plan. So we're emptying the bag, measuring it, and documenting it. Now, pay attention. It says in mLs or cc's. You cannot document this in ounces. We don't use ounces in healthcare. If you go to page 169 in your book, you can see the actual intake and output form that you will be using for the exam. All right, so drainage bags. We have a bladder with a catheter. That catheter has to be attached to something. Otherwise, urine's just going to go everywhere. So we can either attach it to a bedside bag, which is the large bag that I passed around a minute ago, and that's going to hold quite a bit of urine. Or if our patient is out and about in the community, they don't want to carry a suitcase of urine around with them because that's embarrassing. We want something a little more discreet. So that's where a leg bag comes into play. Both of these attach to that same port. They attach the same way to the same port. It's just if they're in bed or in home, bigger bag, we don't have to empty it as often. If they're out in the community, smaller bag can be hidden by clothing and be much more discreet, but it's going to need to be emptied a little more often. Most people with leg bags will empty it themselves, but sometimes CNAs will have to empty them. So this is how a leg bag is worn. It's got some elastic straps. It'll either be strapped to the inside of the thigh or the calf, depending on the patient and their specific needs. But doesn't matter whether it's up here or down here, it's going to attach to the catheter that's exiting the body and hold urine. When a patient's more sedentary, we usually use the bigger bag. So in a hospital or a nursing home, chances are they're going to be using this bag. Usually in home care, you'll see the leg bag. Doesn't matter which one we have, they're both going to attach to the port on the catheter. They attach the same way. Again, you have to be trained. You have to be trained to attach a bag to a catheter. All right, so how do we empty bags? Well, there's a couple of different types of bags that we can use. And every bag is going to be set up a little bit different. Wherever you go to work, they will train you on their specific bag. It's kind of like a car, right? So how many of you guys have a car? How many of you guys own the exact same car? Exactly the same? No? But they're all cars, right? They all work kind of the same. They got a gas pedal, a brake, a steering wheel, and a radio, right? But the specifics of the car might be just a little bit different. Well, that's the same thing as here. They're all bags. They all hold urine. They all work pretty much the same. They have the same features, but the specifics might be just a little bit different. So this that I passed around to you is a T valve. We're going to talk about that in a minute. That's the one you are most likely to use. Yeah, I need you guys to hear this because this is specific to the test. And we're going to be on break in a little bit, so you can go through that on break, okay? So a T valve is the one you're probably going to use on the test. That's the one I'm passing around here. That's the one, remember I said we're going to pass that bag back around? That's the one that we're probably going to want to practice before we get to the test. There are a few others though. This is a clamp valve. It has a clamp, has a tube coming out, and then just a metal clamp that you click to open and close. These aren't used on the test very often, but might be if their supply of these was unavailable. When you go take the test, they're going to show you how to work the valve on the bag if you get this skill. Okay, they'll tell you it's a T valve or a clamp valve. And you can, I'm not familiar with that one. And then the leg bags have a twist valve that we literally twist to open and twist to close. Now, the one thing that you have to remember, no matter what bag we're working with, is that it should only be open when we're actively emptying it. So when we are done emptying, closing these valves is paramount. Very important, because an open valve allows bacteria to enter. Also allows urine to go everywhere, leak everywhere. So we open it to empty it, and then we close it before we return it back to storage. Do not disconnect the bag from the catheter unless you've been trained to do so. This is the #1 error on the state exam for this skill. Students that don't know that, separate the bag and the catheter and take this bag to the bathroom to clean, to empty and clean. We don't do that. This, not our role, unless we're trained. All right, so a T valve is what we're probably going to use on the test. This is what it looks like. It's literally a T valve, and it's got a little house that it lives in. So as I'm talking, you probably want to pass that bag back around so you can see. We are going to pull that valve out of its house, open it by sliding the valve to the side. But when you do that, you cannot touch the end or the tip of that port. Cannot touch the tip of the port. So let me see it real quick and I'll show you. And then we'll pass this back around. All right, Jake, I'll probably need a close up. That's good. All right, so this is a T valve. This is its little house right here. So I'm going to remove it from its little house. Now it's out in the open. I cannot touch this end of the port at all. I want to open this valve by sliding it to the side, staying below the end of the port. Don't touch that end of the port. Now you can see, if you look through here, you can see it's open. See how it's open? When I close it, this is really stiff. See how it's closed? You guys see that? It must be closed before you put it back into its house. The big thing is, don't put your hand here. What most students will do is they'll put their finger here to open it for leverage. Don't do that. We can't touch this end of the port ever. Okay? Put it back into its house. But when you put it back into its house, you can't touch a lot of stuff. We don't want to contaminate this. So open it, empty it, close it, and then just slide it right into its house without it touching everything. Thank you, Jake. All right, so we don't want to touch the tip of the port with our gloves. And of course, we do need gloves for this. When you return that port back to its little house, be careful not to allow it to touch a ton of stuff. Be really careful. So when you move this port and you position it over this cup, that end of the port can't touch it can't touch the inside of the cup, can't touch your gloves, can't touch the chucks, can't touch the bag. It can't touch anything, nothing. Because any pathogens that get on that port will eventually get into the bag. So when we empty the bag, we're going to put our chucks on the floor. We're going to put our graduate container on the chucks underneath the bag, and we're going to empty the bag. Now you can tilt that bag to make it a little bit better to empty, a little easier, but you don't want to disconnect it from the tubing, from the catheter. Don't let that port touch anything as you're emptying it. So once you've emptied the urine into the cup and you've closed the port, put it back in its house, we're going to take that chucks that's underneath the container. We're going to wrap it around the container, because remember, we can't carry an open container of urine anywhere. So we're going to take that chucks covered container over to our bathroom, set it down on the lid of the toilet, and we have to read it on a barrier, on a flat surface at eye level. So when you're looking at this, everything is going to be measured in milliliters or cc's. So we're going to round to the nearest line. This urine, can you guys see the urine? This urine is right about the level of 450. So I would document 450 cc's. I'm not going to call that 449. We round to the nearest line. Okay, so 450, because it's closest to 450. Now, for the test, you can be off by 50 cc's in either direction. So if the urine is here, if you put 400, you would still be okay. If you put 500, you would still be okay. You can be off by 50 cc's in either direction. So I'll pass this around. This is the actual graduate container that you will be using. The lid of the toilet is what you're going to end up using. Yeah. Do not hold a container up to measure. Never hold urine above your face, ever. but we want this on a barrier, on a flat surface, and we want to read it at eye level. So I did this container. I actually had to draw this for you so that you could actually see the urine a little bit clearer. So yeah, my graphic skills are getting a little better. All right. So here it's at 450. This is what we are going to document on the state exam, 450. Let me go back here so we can learn to read this. I'm sorry, I forgot that. All right, so you can see it's all marked in 50s. So we have 100, 150, 200, 250, 300, 350, 400, 450. The lines in between are going to be your 25s. So this line here between 400 and 450 would be 425. That's how we read this. Remember, in healthcare, we do not use ounces. If you wrote 16, you are wrong. All right, we're going to document this on the intake and output sheet after we wash our hands. So we've done our closing, we washed our hands, we're going to document. Make sure, this is the form you're going to get. There's a part for intake and there's a part for output. What is urine? Output. Output. If you document urine up here, you are legally declaring, hand on the Bible, hand in the air, this patient drank urine. This isn't a, oh, I made a mistake, I just documented in the wrong place. There is, in healthcare, documentation is a legal form. Everything you write in healthcare is a legal documentation, which means a lawyer can put you on the stand and say, would you like to explain to me how this patient drank 450 cc's of urine and you did not stop them? And you're going to say, well, no, of course they didn't drink 450 cc's of urine. I put it in the wrong box. He's going to say, it's not what this says. Okay, there are no mistakes when it comes to documentation. Lawyers don't accept it as a mistake. They will rake you over the coals. You don't want to be in that position, so pay attention here. If for the exam you document it up here, you will fail. That's how serious this is. So we want to put the time. If you do not know military time, you should learn it. If you do not know military time, healthcare operates on military time. We work 24 hours a day around the clock. We might be there at 7 a.m. and we might be there at 7 p.m. So we use military time. If you don't know military time, go to page, where is it? 49 in your book. And I have a lesson on military time. You can learn how to do military, but military time is so easy. To me, regular time doesn't make any sense. Right? I mean, we're used to it, right? So right now it's what, 11:10, right? 10 after 11. We are used to it, but I want to know who the bozo was a couple hundred years ago that said, okay, with time, yeah, let's count to 12 and then let's start over. I mean, why? 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 If there's 24 hours a day, why did they stop at 12 and start over? Makes no sense. If there's 24 hours a day, let's use all 24. So instead of stopping at 12, we're just going to keep going. 13, 14, 15, 16, 17, all the way to 24, because that's how many hours are in a day. That makes way more sense to me. I've got a very logical mind. Makes way more. And it wasn't, I can understand if they stopped at 10 because we have 10 fingers, right? I can understand. So these are people that aren't very educated because it's a couple hundred years ago. You just counted to 10 and then you started. But no, they stopped at 12. Why? Yeah, but have you ever stopped to think about why? It doesn't make sense, does it? Crazy. So yeah, military time, super easy. Don't stop at 12. Keep going. 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23. And now it's midnight, so we'll start over again at 0. Okay? So, but the page 49 will help you with military time. We should use military time on the test. If you don't know military time, you can use regular time. You can put 11:10, but you must put AM or PM. Yeah. All right, so let's learn our test-specific steps here with drainage bag. So we're going to put a barrier on the floor. We're going to put our cup on the barrier below the drainage bag. We're going to empty the bag, not letting that port touch anything. You can tilt the bag if you need to empty it. That's fine. We're going to not allow that port to touch anything while we're emptying it. And we're going to close it and put it back in its house without letting the port touch any. Are you starting to get port can't touch anything? Okay, that's what they're really grading us on. We're going to put it back in its little house. We'll gather up our cup and our chucks, take it over to the toilet lid, set it down. We're going to get down and measure it at eye level. So it's on a flat surface, it is on a barrier, and I am down measuring it at eye level. Then I'm going to dump the contents in the toilet, rinse, dry, and store the graduate container like we do everything else. And then I want to look at the bag, make sure it's hanging from a non-moving part of the bed, the tubing isn't coiled near the floor, everything looks good. And then I'll, in my skill, do my closing, wash my hands, and document. You guys see this? Record output with what kind of hands? Clean hands. That's right. And remember, during our closing, we have to end skill with clean hands. So make sure that you're washing your hands at the appropriate times. So let's use all of these principles to check off all of these steps. So we're going to follow our care plan, do our opening, wear gloves, use our barrier, clean our basin like we clean everything else, our test-specific or skill-specific steps, and then our closing. That's how we're going to create this skill. Remember, this skill is just for this patient. Other patients may have a different care plan for this skill. So we're going to watch both videos, catheter care and then emptying the drainage bag. Once we're done watching both of those videos, I'm going to come back on and sign off of online, and you guys can then take your break or practice or a combination of the two. We'll also give you your wrap-up review sheets as well, your class review sheets for today as well. All right, Jake, take it away. Good afternoon, Mrs. Jones. My name is Patty. I'm your CNA today. How are you? Wonderful. I'd like to perform catheter care. Is that okay? Okay, I'm going to close your curtain for privacy, wash my hands, get my supplies, and I'll be right back. Now that I have clean hands, I can get my clean supplies. We're going to place a barrier on the table with the absorbent side facing up. This gives us a clean area for our clean supplies. And for this skill, we're going to need one underpad. We're going to need a towel, 4 washcloths, 1, 2, 3, 4. We're going to need a privacy blanket. We'll bring this over to the patient area. And I'm going to need a basin and soap. And a set of gloves. All right, Miss Jones, I'm just going to fill your basin. I'll be right back. To fill the basin, I'm going to use a paper towel to turn the faucet on because my hands are clean. I'll use my wrist to feel the water temperature. It should feel warm, not hot, not cold, just warm. And we'll fill the basin about 1/4 of the way full. Mrs. Jones, would you like to check the water temperature? It's good? Wonderful. Okay. I'm going to place this privacy blanket over you, and this is going to help keep you warm and provide privacy as we do this skill. So I'll lay the privacy blanket over the sheet without snapping it or shaking it, and then pull the sheet down to about your waist. I'll put the washcloths in the basin. That way they get warm. And I'm going to prepare the underpad to go under the patient. I'll open it up. I'm going to hold it up lengthwise with the absorbent side facing me, and I'll roll it all the way to the end. Now I can put my gloves on. Okay, Miss Jones, we're going to place an underpad under you to keep your sheets dry while we do this skill. So I'm going to place an underpad on the bed. And in just a moment, I'm going to ask you to scoot toward me. I'm going to roll you on your side, and then we'll spread that underpad out. So on the count of 3, go ahead and scoot toward me. 1, 2, 3. Thank you. And now I'm going to roll you on your side. 1, 2, 3. And as I roll the patient, I want to be careful not to put any stress on this catheter or the tubing. You don't want it pulling tight. So I'm going to unroll the chucks underneath the patient and tuck it under her hip. Miss Jones, come on back and scoot to the middle of the bed, please. Okay, Miss Jones, we're going to repeat the process. Go ahead and scoot toward me. And we're going to roll you onto your left side. 1, 2, 3. And I'll smooth that chucks out underneath the patient. Come on back onto your back. And then scoot to the middle. Now we can begin the cleaning. Miss Jones, I'm going to expose you. I'll make this as brief as possible. But please let me know if you're uncomfortable in any way. I'm going to roll the privacy blanket, making sure that I get the gown inside the blanket as I roll it. But I don't want to grab that catheter as I'm rolling the blanket. So you want to be very gentle with this process. This is going to expose the peri area. And then I'll place a towel over the upper thighs and make sure that the catheter tubing is on the towel. This is to help minimize exposure, increase comfort, and gives a place to put the catheter while we're cleaning it. Now I'm ready to start cleaning. I'm going to take my first washcloth, wring it out, and I'm going to soap 5 corners. 1, 2, 3, 4, 5. I'm going to hold the catheter out of the way, retract her labia, and then wipe down the center, top to bottom, and then move away and fold that leaf. The second leaf will wash the outside of the labia, top to bottom. We'll fold that leaf over. This is going in one direction only, top to bottom. This third leaf is going to wash the other side of the labia, top to bottom. We'll fold that over. The fourth leaf will wash the skin fold between the leg and the groin, top to bottom. We'll fold that over. The last leaf, we'll wash the skin fold on this side, top to bottom. Now we'll set that aside on the barrier. And whatever we wash, we rinse. So we're going to wring that washcloth out really well. Hold it using the leaves method. I'll hold the catheter out of the way and open the labia and rinse down the center one direction, top to bottom. We'll fold that over. We'll rinse the outside of the labia, top to bottom, fold that over. The other outside of the labia, top to bottom, fold that over. This is going to rinse the skin fold. Fold that over, rinse the skin fold. We'll set that aside. Now we're going to clean the tubing. So I'll get washcloth number 3, wring it out really well, hold it using the leaves method. And I'm going to soak 4 leaves. 1, 2, 3, 4. I'm going to hold the catheter where it exits the body so it doesn't pull on the inside. Wrap the washcloth around the catheter and wipe away from the body. We're going to fold that over and repeat 3 times. Hold the catheter, wipe the washcloth around, and move away from the body. 2, 3, changing the leaf for each stroke, and 4. We'll set this aside. Whatever we wash, we rinse. I'm going to wring the rinsing washcloth out thoroughly, hold it in the diamond shape in my hands, hold the catheter where it exits the body, wipe the washcloth around, and rinse going down the catheter. We'll fold that leaf, rinse 2, fold that leaf, rinse 3, fold that leaf, and rinse 4. We'll set that aside. Whatever we rinse, we dry. So we'll dry the peri area top to bottom and the catheter tubing. We can remove the towel, set it on the table, and we're going to unroll the privacy blanket, trying to be careful not to touch that gown with your soiled gloves, and we'll cover the patient up. Mrs. Jones, can I get you to scoot toward me, and I'm going to remove the pad that's under you. Go ahead and scoot toward me, and on the count of 3, you're going to roll up. 1, 2, 3. I will roll the soiled chucks toward the patient and tuck it underneath her hip. Come on back, Miss Jones. When I'm moving Mrs. Jones, because my gloves are soiled, I'm only touching the outside of the privacy blanket. Mrs. Jones, scoot to the middle of the bed, please. And now we can remove your chucks. If you can scoot toward me, again, my soiled gloves are only going to touch the outside of the blanket. And then you're going to roll up on your side, 1, 2, 3. And I'll remove that chucks from under the patient. Come on back onto your back. And then if you can scoot to the middle. Thank you. I'm going to go dispose of this. Okay, Mrs. Jones, you're covered. You're safely in the middle of the bed. I'm going to go dispose of your linens and clean your basin. I'll be right back. These items will go in dirty linen. We're going to clean this basin the way we clean all basins. I'll bring the basin to the sink and we'll dispose of the water in the sink. Rinse the basin and then dispose of the rinsed water into the sink as well. I'm going to set that down, disinfect it per facility policy, and then pick it up with a paper towel. I'm going to get a clean paper towel to dry the inside. I'm going to get a clean paper towel to dry the outside. And then one more for the drawer. On the way, we'll pick up the soap, place it in the basin, use the paper towel to open the middle drawer, pick up the lotion and put it in the basin, and then store the basin in the drawer. We'll close it with a paper towel and then throw those paper towels away. Now we can dispose of the barrier. This will go in the garbage. And I can remove my gloves. Okay, Miss Jones, I'm going to remove your privacy blanket now. I want to check your tubing real quick just to make sure that it's not kinked and you're not lying on it. So it looks good. It's not near the floor. So I'll pull the sheet up over the privacy blanket. This ensures that you're always covered. And I'll remove the blanket as I do so. Want to make sure that the blanket is rolled into a ball so trailing edges don't contaminate other surfaces. We'll make sure that the sheet looks good. All right, Miss Jones, just let me go dispose of this in dirty linen. I'll be right back. We'll adjust the sheet on this side. There you go. Is there anything else I can get for you while I'm here? Are you comfortable? Would you like a magazine? Your bed is in the low position. Your environment is clean. Here's your call light. If you need anything at all, go ahead and press the red button. We'll be happy to come help. I'm going to open your curtain and return your overbed table to storage. Now I'll go wash my hands. After washing my hands, I'll review the care plan, make any corrections, and tell the evaluator my skill is done. Good evening, Mrs. Jones. How are you today? Fantastic. I need to empty your urinary drainage bag. Is that okay? I'm going to close your curtain for privacy, wash my hands, get my supplies, and I'll be right back. After washing my hands, I'll get my supplies. We're going to start with the chucks. This is going to go on the floor under the bag. We're going to place the barrier on the floor directly under the urinary drainage bag. So we'll unfold it and we'll place it under the bag with the absorbent side facing up. I'm going to go get a set of gloves. And we're going to get the graduate container out of the drawer. You need to make sure that you put your gloves on before you get the graduate container. We're going to place the container on the barrier directly underneath the bag. We use the emptying port to empty the bag. This is a T-valve. We slide it to the side to open the valve, and then we're going to empty the urine into the graduate container without letting that port touch anything. Once the bag is empty, we'll close the port and place it back in its little house. All right, Ms. Jones, I just want to check to make sure the tubing is coiled on the bed and you're not lying on it, and that it's not coiled near the floor either, where it could become a tripping hazard. Now, I can wrap the chucks around my graduate container for safe and secure transport to the bathroom. We're going to set it down on the lid of the bedside commode and unwrap it, turning the cup around so that we can read the amount of urine that's in the cup. We need to be at eye level. It needs to be on a flat surface and on a barrier. I'm going to throw the chucks away. Open the lid and the seat and dispose of the urine into the bedside commode. I'll rinse the cup and dispose of the rinse water into the bedside commode as well. We'll close that, set the graduate container down in the sink, and disinfect it per facility policy. I'll pick it up with a paper towel, dry the inside with a paper towel, throw that away, dry the outside with a paper towel, throw that away, and one more for the drawer. Okay, Miss Jones, I'm just going to return this to storage using a paper towel to open the drawer. And closing the drawer, we'll throw those paper towels away, and then I can remove my gloves. You take a peek at your tubing just one last time. Everything looks good. Are you comfortable, Mrs. Jones? Is there anything else I can get for you while I'm here? No? Would you like a magazine before I go? Your bed is in a low position. Your environment is clean. I'm going to open the curtain. Here's your call light. If you need anything at all, just press that red button. We'll be happy to come back and assist you. Thank you very much. I'm going to go wash my hands. After washing my hands, we'll document the amount of output on the documentation sheet provided by the evaluator. We're going to document the time of output, the type of output, which is urine, the amount of output in cc's, and my initials. And we want to make sure that we're documenting in the output section. After documenting, I'll wash my hands one final time. After washing my hands a final time, I'll review the care plan, make any corrections, and then tell the evaluator my skill is done. Okay. All right, any questions on those two skills? Any questions? No questions? All right. So our practice, I talked to you today about practice, how important it is. Our practice kit, just so that you know, has both the triangular graduate container and the drainage bag. So you can get used to that T-valve, you can practice with it. It also has the bedpan for that skill, has pretty much everything you need in the kit to be able to practice all of the skills that we've learned so far. So for you guys, up through Wednesday, it's $45.99. On my website, I think it's $69.99. So you guys get a significant break on that. So homework tonight, you have chapter 10 in your book. It's the last chapter. If you've fallen behind on homework, please make sure you get caught up. You will need to return your yellow book in class on Wednesday. We will take a class photo on Wednesday. So please be in your uniform t-shirts. And this book is yours to keep. So CPR class, remember, you don't need it for class, you don't need it for testing, but you probably will need it to work. So keep that in mind. That'll be your next step. And Jake's going to hand out your review sheets for today. Those of you who joined us virtually, thank you so much for tuning in. Remember that Wednesday is graduation. You'll probably want to tune in for that for really good job hunting tips. It'll help you find a job and land that job. And then next Tuesday is our next game show. So until next time, happy caregiving. Bye.